Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Chromulin as part of the Chromulin series. This audio podcast as part of a Spectro Integer, and this audio podcast as part of a Storm Robotics production. Today, looking at hematuria and the presentation around hematuria. So Hematuria may be idiopathic or unknown and or benign, or it can be a sign or a sign in around the presence of a kidney stone or renal stone or a tumor in and of the urinary tract. If white blood cells (WBCs) are found in addition to RBCs or red blood cells, then urinary tract infection is a probable diagnosis. Occasionally, the terminology hemoglobinuria is used to indicate a high red blood cell count or RBC count in the urine. And although this may not be directly indicative of hematuria particularly. It is important to take a full urological history and include palpation of the abdomen and arterial blood pressure. Examination or investigation should also should include thorough. It should include looking at the features of potential renal involvement, including renal function investigations and known previous renal abnormalities, and as well indications of hematuria. It is also important to appreciate that hematuria without specific or particular symptomologies does not necessarily specify a non-glomerular origin, as glomerular bleeding is not automatically associated or with is not automatically associated with with either um, hematuria or other hematuria or other hematuria like symptomologies. That draws this audio podcast to a close. This audio podcast as part of the Chromulin series. This audio podcast as part of a Spectro Integer, and this audio podcast as part of a Storm Robotics production.